An 18-year-old baseball player, Willie Ramirez, was taken to a hospital in a coma. Willie's family thought he had eaten something that may have caused his symptoms, so they used the word intoxicado to explain his condition. Intoxicado in Spanish means that you ingested something that made you sick. It could be food, it could be a drug, it could be anything. An untested and untrained interpreter interpreted intoxicado as intoxicated. The doctor immediately made a diagnosis of drug overdose. A couple of days later, the health team figured out that Ramirez's problem was actually bleeding in his brain, but by then, he'd suffered lasting damage and he ended up quadriplegic. This is one of many stories that emphasize the importance of qualified interpreters. Interpreter errors play a significant role in medical mistakes. In a study conducted by Boston Medical Center that involved trained interpreters, ad hoc interpreters, and family members, the most common interpreter errors were omission, in which the interpreter left out an important piece of information; false fluency, in which the interpreter used words or phrases that didn't exist in a specific language; substitution, in which a word or phrase is replaced with another word or phrase of a different meaning; editorialization, in which the interpreter's opinion is added to the interpretation; and addition, where a word or phrase is added by the interpreter. The study emphasized that untrained and unqualified interpreters were more likely to make errors than qualified and trained interpreters. Qualified bilingual staff are essential in giving providers, limited English proficient patients, and their families a voice to overcome language and cultural barriers, as well as improving the quality and safety for all patients. Training programs, such as the Qualified Bilingual Staff Program, are an important part of healthcare in providing culturally and linguistically appropriate services and setting a high standard of quality of care. Their passion, skills, and expertise are an asset to the field.